they've earned. The other thing, a big one, is healthcare. Hopefully when the VA hospital finally opens up, that should help. But in my concern is that the VA hospitals, you got to pack a lunch, and, go all the way over to the far northwest, to go over to the 215 Pecos area. It's not in the most easily accessible place. And from what I understand is they're going to pull all the clinics back to the hospital. So all these little satellites that are now down around Rancho and Charleston will go out to the main hospital, which really doesn't make it very convenient. We need to continue satellite clinics. We also need to put clinics in more of our outlying areas like Mesquite and Laughlin, because we have big veterans populations in those two towns, and they have to travel in to the city every time they want to get veterans care. So we need to have greater access to the medical benefits that veterans have. Believe it or not, the state has done a lot of really interesting things for veterans in regards to National Guard service members and veterans, and extending tuition credits and giving the regents the ability to allow National Guard service members now who are killed in the line of duty for their children or widow to go to school tuition free. So there's a lot of educational opportunities, and the last modification of the GI Bill has opened up a lot of opportunity as well, except they didn't expect the big rush they were going to have, and there's a big delay in getting those benefits processed, especially the educational benefits. So I think that when we look at the big things, it's access to health care, it's making sure we have the infrastructure so that they get the benefits they've earned, and it's the educational benefits, and those are the three things that we have to concentrate on. Yes, sir. And here, if I start going too long on this one topic, somebody just wave at me. Washington is trying to couch this debate as healthcare reform, and it's really not healthcare reform. When you get down to it, it's health insurance reform. If they wanted it to be healthcare reform, it would look at a lot of other issues, including tort reform. And tort reform is critically important. I'm not saying that just because I'm a doctor and I don't want to get sued. It is critically important. Not so much from a malpractice premium perspective, but from the cost of defensive medicine. I work at UMC, we have residency programs, and so I'll have a resident that'll present their case, and I'll ask, okay, so what are you going to do? And they'll tell me all these tests they're going to order. I'm like, why are you ordering all these tests? Because I don't want to get sued. Well, but is it going to really make a difference for what you're going to do for this patient? Probably not. So then why are you ordering the test? That's how people are coming out of medical school and residency now. It's not about the science of medicine and using your skills and abilities to evaluate somebody and come up with a diagnosis. It's about, let's just shotgun 20 tests and see what shows up, and then we'll know what we're going to do. So tort reform is critical because it will decrease the defensive cost of medicine. And it will have a stabilizing effect on malpractice rates. We passed tort reform at the state level in 04, some 03 special session into 04. And at that time, to show you the impact, the UMC Trauma Center had to close down for 2 weeks because all the orthopedic surgeons resigned from the staff, saying that it was just too expensive to maintain malpractice insurance to take orthopedic call at the trauma center. So they resigned. And once they did that, the trauma center had to close. And at the time, it was the only trauma center in Southern Nevada. And that's what made people really wake up and understand that we were down to 2 or 3 medical malpractice insurers here in the state writing policies. So supply and demand. You only got 2 or 3 writing policies. They can charge what they want and get it because everybody else left the valley. But with the tort reform that was passed, we now have a wide array of malpractice underwriters. Rates have stabilized and in some cases gone down. And we've seen that the exodus of physicians, people say, not a lot of physicians left Nevada. You're right, but a lot of physicians decided to prematurely retire, or a lot of physicians curtail certain aspects of their practice. Like a lot of OB-GYNs just stuck with the GYN and stopped doing the OB, because that's where the risk was. And so with those reforms, so we've seen it work. with those reforms, that was reversed here in Nevada. So it's a critical issue. Unfortunately, it's been said it's not on the table. It's not been in any of the bills except one, and that was Senate Bill 1099, which was the bill submitted by Senator Coburn out of Oklahoma, who also happens to be a doctor. But that bill hasn't received even a committee hearing as yet. So it's a tough issue, but it's one that if we truly want comprehensive health care reform, it has to be on the table. The question has to deal with the Department of Homeland Security and what they're going to do about Guantanamo, and if we, how are they going to keep us safe from another attack? I'll tell you, I'm probably not the right guy to ask because I'm not a big fan of the Department of Homeland Security. In fact, my thesis for my master's in War College was securing the homeland. Is the Department of Homeland Security relevant? And you know, it's a very difficult question because it depends on how many individual liberties you want to give up to be secure. You know, and it's a balancing act. We could be very secure, but we wind up living in a police state. You know, how much more poking and prodding do you want to go to through when you go to the airport or when you try to get on an Amtrak train? Those are the balances that we're trying to strike, and it's been very difficult, especially in such a heterogeneous population as the United States, where there's a lot of people with a lot of varied opinions about what they're willing to give up in order to be more secure. Now, have we been successful in deterring further attacks on U.S. soil? Certainly. But the other school says, you know what, it's just their normal planning cycle. If you look at when things happen, the first World Trade Center bombing was in '93, and where did they go after that? They went to other places. They bombed us in our embassies in East Africa, they bombed the USS Cole in Yemen, and then they came back in 2001 and hit us again on U.S. soil 8 years later. So after we've gone a full 10 years after 2001, then I'll say, okay, we're probably doing a good job. And that's probably been stretched out a little bit because of the conflicts and what we're doing over in Iraq and Afghanistan in breaking up their ability to have time to plan. But it's a very difficult issue, and the Department of Homeland Security is wrestling it with the best they can. You know, when they created DHS, that was the largest reorganization of federal government since 1947 in the National Security Act, which formed the Department of Defense. Before that, it was the Department of War and the Department of Navy. They put them together into one big department. So this was the largest reorganization. 22 different federal agencies that didn't really work and play well together to begin with. And now they put them all under one cabinet secretary and saying, okay, now you all work for the same boss. And they're still having a lot of growing pains. Yes, sir? Great question. The unemployment rate, as you all probably know, we're the second highest right now in the country after Michigan. I guess that's the only good thing about GM is that they helped us not be number one in the unemployment sector. And how are we going to take care of those issues, especially how it impacts, or the impact of illegal immigration on that? The first thing is we have to be more stringent with the enforcement of current laws that's telling companies, you know what, you can't employ illegal immigrants. And so, oh, it's too onerous for us to figure that out. That's not true. There's a system called E-Verify that you can punch in the Social Security number, and the person, it'll tell you whether or not the person is able to legally hold a job in the United States. The problem is a lot of the bigger businesses don't want to do that. They like having the illegal immigrant labor. And that displaces citizens from getting those same jobs. And this idea of, we hear, well, they take the jobs that Americans don't want. I think right now you'd be hard-pressed to find an American that would turn down any job. Whether it's making beds at a resort or, bussing tables at a restaurant. And so we have to be more stringent with trying to